Hello everybody. Our topic name is chronic gastritis and gastroduodenitis. What is this, the chronic gastritis? Chronic gastritis and gastroduodenitis are long-term inflammatory disease of the stomach and duodenum. They involve mucosal damage and functional disturbance in acid secretion and digestion. So, definition. Chronic gastritis is present inflammation of the gastric mucosa. Gastroduodenitis is chronic inflammation involving both stomach and duodenum. Etiological factors. It's the 90%, 95% of chronic gastritis causes by Helicobacter pylori infection, autoimmune reactions, chemical irritants, dietary factors, stress and smoking, genetic predisposing. Pathogenesis. Helicobacter pylori damages mucosa via toxins and inflammation. Autoimmune mechanisms destroy parenchymal cells. Reduced mucosal defense and after will be acid injury, chronic inflammation, and leads to glandular atrophy and intestinal metaplasia. Classification by causes. It's type A, autoimmune, type B, Helicobacter pylori related, type C, chemical, by location, antral, fundal, and pangastritis, by severity, mild, moderate, and severe. Chronic forms. It's superficial gastritis, atrophic gastritis, hypertrophic gastritis, and erosive gastritis. Clinical features. The main clinical features of chronic gastritis is epigastric pain or discomfort, nausea, vomiting, early satiety, bloating, heartburn, loss of appetite, weight loss in chronic cases. Gastroduodenitis features. Symptoms overlap with gastritis, but pain may irritate to the back. Also associated with duodenal ulcers. Complications is peptic ulcer disease, gastrointestinal bleeding, iron deficiency anemia, vitamin B12 deficiency, and gastric carcinoma. Diagnostic criteria is history and clinical symptoms. Endoscopy is the gold standard of diagnostic. Mucosal erythema, atrophy, erization can be. Biopsy, chronic inflammatory cells, atrophy, metaplasia, and H. pylori testing, urea breath test, stool, antigen, and biopsy. And last one is pH meter and gastric secretion tests. Laboratory findings. Low or normal gastric acid secretion. Positive H. pylori test. Low serum pepsinogen. Low vitamin B12 and anemia. Comparative diagnosis. It's differential from peptic ulcer disease, functional dyspepsia, gastric carcinoma, and gastroesophageal reflux disease. Treatment principle. It's etiological treatment, eradication of H. pylori, pathogenetic treatment, and symptomatic therapy. So, H. pylori eradication therapy contained triple therapy. Triple therapy, it's PPI, omeprazole 20 mg for 14 days. Next one is amoxicillin 1 gram twice, 7 days. Duration is 7 days. And clarithromycin 500 mg twice. also 7 days. The next one is dietary. Dietary, it's avoid spicy, fried, and acid foods. Eat small, frequent meals. Avoid alcohol, smoking, coffee. Include milk, soft foods, and vegetables. So the treatment also including vitamin B12 supplementation, iron replacement, and monitoring for gastric carcinoma. Uh, Treatment of a chemical type was avoid antacids. These treat bile reflux and prokinetic agents. Prevention. Early detection and treatment of H. pylori infection. Avoid irritants, NSAIDs, and alcohol. Maintain balanced diet, stress management, and regular medical checkups. Prognosis is good with early treatment and eradication of H. pylori. Chronic atrophic changes may predispose to malignancy. And in the summary, I can tell that chronic gastritis and gastroduodenitis are common and treatable. Etiological mainly involves pH pylori and autoimmune factors. Diagnosis and clinical is clinical and endoscopic. And treatment includes eradication therapy, acid suppression, and